Hello, my name is Alexandria Saldarocha, and today we'll be discussing Hashimoto's thyroiditis. These are the contents of this slideshow that relate to Hashimoto's thyroiditis, and I will be discussing each of them shortly. So the thyroid is a butterfly-shaped gland found at the front of the neck, so around this area. The hormones secreted by this gland regulate many things, such as breathing, weight, mood, and energy consumption. The thyroid is part of the endocrine system, which is responsible for the body's release of hormones into the bloodstream. Right here we have this image of a normal thyroid with normal thyroid function. The pituitary gland releases thyroid stimulating hormones, which is the TSH, and then it goes to the thyroid, and thyroid itself releases thyroid hormones shortened to T3 and T4. We'll get into that later on in the slideshow. So this organ is right under the voice box and around the windpipe. The thyroid hormones occurs in a negative feedback loop where the amount of hormones produced increases or decreases depending on what the body needs. So there are three hormones that are produced by the thyroid, or three main hormones. Right here we can see this image. There's T3, T4, and calcitonin, all produced by the thyroid gland. See. The amount of hormones needed varies within the body depending on every unique situation. The pituitary gland, as you can see in this image, instructs the thyroid on what exactly to make, and it does this by using TSH, as we discussed earlier. So interestingly, one main element of these two hormones is iodine that the body cannot produce itself, so it's taken from the diet. Once iodine has been absorbed into the bloodstream, it is carried into the gland where it's used to make T3 and T4. The third hormone is made by cells in the thyroid called the C cells. Okay, so we're going to move on to the next slide. Genetics actually plays a huge role in determining the quality of the thyroid. So family history does play a large role, about 80% predictability of how the thyroid will behave throughout a patient's life. In this next slide, we have two images, one of a normal thyroid and one of Hashimoto's thyroiditis. So this is clearly more swollen. Right here, you can see the outline of a normal thyroid, and it's clearly larger, which causes a goiter, which is a symptom that we will get into further down the slideshow. A healthy thyroid produces hormones for the body, but disease in the gland can cause it to not work properly. In Hashimoto's disease, the thyroid is attacked by an autoimmune response. This condition was named after the doctor who identified it in 1912, Dr. Haruko Hashimoto. There are many names for this disease, including chronic autoimmune thyroiditis and Hashimoto's thyroiditis. The autoimmune response sometimes results in the thyroid not making enough hormones. This is known as hypothyroidism. In rare cases, the same disease can cause hyperthyroidism, which is when the thyroid makes too many hormones. Although Hashimoto's disease can lead to hypothyroidism, not everyone who has the disease of Hashimoto will develop hypothyroidism. So what exactly is this autoimmune response? What happens to have this condition? So the immune system, creates antibodies that attack the gland where the lymphocytes, which are a type of white blood cells, build up around the thyroid over time and damage tissue. So as we can see right here in this image, a normal thyroid and once again an enlarged thyroid. So something that's clearly affected, something is clearly wrong. And you can see all the buildup of what it used to be or what a normal one is. A common first symptom is this goiter, excuse me. Um, you can clearly tell that it's inflamed, it's sore, but usually this wouldn't hurt. It would just make the neck look swollen. So symptoms of this disease can progress very slowly, and this is usually one of the telltale signs that Hashimoto's disease is within the body. Since the hormones secreted by the thyroid are associated with body growth and energy distribution, other common symptoms for hypothyroidism caused by Hashimoto's disease include fatigue, muscle pains, weight gain, and joint stiffness. Okay, now we will discuss the diagnosis of Hashimoto's thyroiditis. It's often difficult. Symptoms come pretty slowly or pretty vague, but the largest, symptom is the ingrowth neck or the goiter. Blood tests are done to check the function of the thyroid if any abnormalities occur. sometimes referred to as the thyroid function test, the TFT. In these tests, labs look for abnormal levels of T4 or T3. Healthcare providers can also order an antibody test to determine issues with the thyroid. So, seeing that Hashimoto's thyroiditis is an autoimmune response, the body will attack its own body with the antibodies that it creates. So, if there is a large number of antibodies in the blood, it could be because the body is undergoing Hashimoto's thyroiditis, which could cause the inflammation. Right here, we have a handy dandy little flow chart, which pretty much, in the simplest terms, shows us what is the result of every test. If there is an increase in T4 in the body, it could be these secondary hyperthyroidism or primary hypothyroidism. If things are normal, then levels are going to be normal. If there is a decrease in T4 in the thyroid or in the body, it could be primary hyperthyroidism or secondary clinical hypothyroidism. Speaking of diagnosis, AI contributions also play a large role in contributing to the diagnosis of Hashimoto's thyroiditis. So, artificial intelligence itself offers a wide new variety of tools for healthcare workers and clinical research. The hormones that secrete from the thyroids are fundamental for the development of growth, fertility, and metabolism in the body, as we discussed, and diseases like thyroidism, Hashimoto's thyroidism affects millions worldwide. As a result, the thyroid function tests, as we've discussed before, TFT, are ordered more frequently for diagnosis and disease monitoring. When AI system, for example, when an AI system was fed a large amount of clinical data, the results showed that its algorithm was more accurate than those of radiologists diagnosing similar cases of potential thyroid diseases like Hashimoto's thyroiditis. Specifically, they had an 84% accuracy rate. With this system, if AI diagnosis tests can be ordered faster upon suspected cases of thyroid diseases, and can be done a lot more quickly and with more accuracy. Here we have a simple image discussing the integral AI functions relating to thyroid function tests. We have a person who can possibly cause, human error, and then we have an AI function that is just purely fed clinical research. So treatment for Hashimoto's disease can vary depending on the patient's condition. If the patient has not caused if that disease has not caused hypothyroidism, then there might not be any need for treatment at all. So the doctor will most likely regularly check the growth on the neck, the goiter, and constantly check the patient's hormone levels to see if everything is up to par. So if the condition has caused hypothyroidism, then hormone therapy can treat the body's ailments. Levothyroxine right here is a very common treatment in hormone therapy. It's a synthetic version of T4 and is used to treat the body's lack of essential thyroid hormones. This medication is prescribed in a pill form, a liquid form, and a soft gel capsule. These forms allow for those with digestive issues to receive the medication, or if the growth on the neck allows, for issues swallowing. There's also another synthetic form of another hormone which is used to treat hypothyroidism. Cytomel right here is takes the role of a synthetic T3. These medications both are agnostic of the beta and alpha hormone receptors of the thyroid. These hormone therapies do not cure the thyroid issues. They do not cure Hashimoto's thyroiditis. So these both treatments will be lifelong. The side effects of both include chest pain, irregular heartbeat, and irritability. Now we have come to the demographic slide. Who exactly is most at risk? So anyone can develop Hashimoto's disease, but there are factors that are common amongst those cases. Those more likely to develop Hashimoto's disease include those who are middle-aged, have other autoimmune diseases, genetics, and are female. The age demographic ranges from about 30 to 50 years of age. Due to sex hormone influence, females are 10 times more likely to develop this disease Females' risk of developing this disease increases during pregnancy as hormones and immune function fluctuate. Having conditions like lupus or type 1 diabetes makes one much more susceptible to developing Hashimoto's disease. In the United States, 5 in 100 people are affected. When studies were done in other geographical regions, it was found that there are 0.3 to 1.5 cases per 1,000 persons. Okay, for a final overview, Hashimoto's thyroiditis itself is not harmful. It's just the growth and the inflammation that doesn't usually hurt, but it does cause other symptoms that aren't very severe, but it can lead to hypothyroidism. And in some cases, hyperthyroidism, which then causes the thyroid gland to not work properly. It leads to symptoms that have to be treated with hormone therapy, such as the synthetic T3 and T4. With this hormone therapy, it takes the place of natural thyroid hormones, but it's not a permanent solution and will require lifelong treatment of the condition. This disease is actually pretty common in this, and especially among the middle-aged women. Okay, and these are my references. Thank you for watching.